The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
And welcome to Project Independence and You here at Senior Talk Radio. That's WCWP.org or 88 and 88.1 FM on the radio. You can also listen to WCWP on their app, which is WCWP Radio, which really gives you great live feed. So Project Independence and You is part of Senior Talk Radio. And we have a wonderful guest today, Gregg Balbera, who is the owner of Right at Home, and he is a certified senior advisor. So the first hour of the show, we will be talking with Gregg. And of course, the wonderful co-host today, as always, is Otto Los. Otto, you've been the co-host every show since we went on to Zoom, since we went live since COVID. So of course, thank you so much.
Well, thank you. It's always fun to be here, and it's also informative.
Yes.
I learn a lot.
Yeah, we all do. We all do.
Yeah.
And of course, the incredible Kristina Liu, who is Project Independence and You's radio show producer and does this every week, collects the guests, gets the information, and makes everybody look really good. Makes it easy for us. Like I always say, we never have to do anything. It's just she hands you the paper and you sound like you've done it all. But really, it's Kristina. So
aim to please, guys.
It's great. So again, I'm Rebecca Miller. I will be your guest host today. So we're going to start the show out by speaking with Gregg Balbera. And Gregg, I know you've been on the show before, but we talked a little bit before the show started. You haven't been on since COVID. So I know that there's been a lot of newer issues and more complex issues with, the added COVID with having to do with geriatric mental health. But before we get into that, can you tell us a little bit about Right at Home?
Absolutely. First of all, thank you for having me again. It's always a pleasure to be with Project Independence. So Right at Home, we are a licensed home care agency. My wife, Eileen, and I own and operate our agency. We provide aids and companions for seniors and mobility challenged adults throughout Long Island, Nassau, and Suffolk. Mm-hmm. And we do everything from 4 hours a day to 24 hours a day, 7 days a week, depending upon the client's needs. And we help our clients with a whole range of services, and that can be anything from safety supervision, fall prevention, assistance with personal care, so bathing, toileting and dressing, med reminders, meal preparation. Obviously, companionship is a big part of what we do, and we'll certainly talk a lot about that with regard to geriatric health. Transportation, we drive our aides. Our aides will drive our clients to doctor's appointments, food shopping, pharmacy, the library. Obviously, pre-COVID, and hopefully sometime in the near future, to other things, whether it's out to local parks to get some exercise, or to senior centers, which have been mostly closed down for the past year. So we help them in a variety of different ways.
What's your staffing like at Right at Home?
So our particular agency, we have about we have an office staff of about 8 people, including a full-time RN who oversees the plan of care for all of our clients. We have a client care coordinator who will go out in the field. She's specially trained in many different fields of dementia, which is a big portion of our client base. So sometimes it's she's assessing the clients, helping family members come to grips or realization with where their loved ones might be in the scale of dementia from mild to extreme. But she's also providing a lot of training to our aides in the field, helping them with learning how to deal with clients who might be sundowning, helping them to learn how to redirect. One common thing that we see a lot with our dementia patients is loss of short-term memory, and they can become very repetitive, ask the same questions. So there's a certain skill involved for an aide who can can redirect that client so that they're not constantly focusing on the same thing. So getting them to do something else, redirect their behavior or their, or their mindset to move on to something else. Obviously, you can't eliminate it 100%, but doing those little things can certainly improve the quality of life of our clients, and that's our goal every day.
Greg, during COVID, obviously, your normal method of operation has to be almost shut down. How have you been functioning since last March?
So we are actually one of the businesses where we were not almost entirely shut down. I mean, we shut down our office. My wife and I were working from the office, but we had our office staff working remotely. But our aides, they don't really work in the office. They're working in the home, and the home is many different places. It could be in a private home that that a senior has lived in for 40, 50, 60 years. We work in a lot of assisted living facilities where certain clients need more one-on-one care. As opposed to what the assisted living is providing on top of the meal preparation, the housekeeping. We did a lot of work in rehabs and in hospitals, so that work kind of got shut down a little bit. Rehab and hospitals, they shut down. Where our sitter services or people who would sit with a client in a hospital, that kind of certainly tapered off dramatically during COVID because we weren't allowed into those facilities. But our work in the home, people who need help still needed help. If you had a senior that has dementia or has Parkinson's, had a broken hip or a shoulder surgery and couldn't move one arm, they needed the services that we provided. Again, personal care, bathing, toileting, dressing, meal preparation, helping them with their laundry, changing their sheets, light housekeeping around the house. So, a lot of those services you can't. Even though COVID was here and it was obviously prevalent for everybody, dramatically, certain of those services could not come to a grinding halt. Certain people just could not survive without the care that we provided. Sometimes families did step in, where they could. As we saw throughout the country, a lot of families came back together. Children who might have been living further away, or adults, parents who were living further away, kind of congregated together. Which wasn't necessarily happening before COVID. So in some instances, families were chipping in and living together, and so some adult children were able to provide certain care for their adults where we might have been providing that care previously. But there are plenty of situations where we see where sometimes certain seniors don't want their adult children taking on that role. They don't want to have that role flipped of parent and adult. Where the child is now taking care of the parent. Not every adult wants their child, helping them in the shower or in the bathroom. There's some privacy issues and stuff like that. So that's where we come in, on a daily basis, but even more so during COVID.
So aides were allowed in the home?
Yep. We obviously were providing, PPE, the personal protection equipment. So gloves. We were providing masks, face shields when necessary, especially when New York was the hot spot, goggles. If we had people who were exposed, our aides were given, gowns and, the headdresses. So they were completely covered, as well as hand sanitizer. So yes, in the home. And if we were working in an assisted living facility, the caregivers were getting tested for COVID at least on a weekly basis.
Have you seen, I'm curious, has there been a difference or a particular increase in a service, a different, one of the services that you provide because of COVID, because seniors are more, staying at home, especially in the beginning?
Sure. So just, our most basic service at Right at Home is probably companionship. So because of the inability to travel, I'm not sure if you guys are aware, but AARP put out a study a couple of years ago, and on average now the adult children live 280 miles away from their parents. It's not like when we were kids or when I was a child, certainly probably when Otto was a child, when the families would live right next door, maybe in the same building complex or on the same block. Now everyone's kids are much further apart. So what we would see a lot is a lot of our clients, their children live Florida, California, Maryland, Chicago, wherever it might be. Because of COVID, they weren't able to travel. So, twice a year to monthly visits that, adult children might have been making, previous to COVID, wasn't happening last year. So a lot of those, adults and a lot of their children wanted eyes on. So that's where we were able to provide, an added layer of service in that particular situation. Our aides were with the adult who needed care, and we were able to report back to the children what we were seeing and what was happening. If there's a change in condition, is someone losing weight? Are they sleeping more than they were sleeping? A lot of the issues that we can talk about in a few moments because of the depression of COVID, we were able to kind of report and help facilitate issues like that.
What level of companionship does Right at Home provide to the seniors?
So it's pretty much every level of companionship. So some people just need someone to sit and talk with, to have that one-on-one communication every day, so they're not sitting in their house or their apartment by themselves and watching 18 episodes of The Price is Right all day long. Our aides, when the weather is nice, like we have a beautiful day today here in New York, on a day like today, we try and encourage our caregivers to get our clients out and about. So obviously we have some clients who have no mobility issues at all, and then we have other clients who are using walkers, canes, rollators, wheelchairs. We encourage all of our aides to get our clients out and about. So if someone's in a wheelchair, if we can roll them out into the backyard, if they have a patio, get the fresh air, see the birds, see the leaves starting to and everything starting to our and blossom, we encourage that. We have clients who maybe use walkers or canes to take a walk around the block. A lot of our clients will have maybe like a local park. Sometimes we'll have our aides pack a lunch for the two of them. We talked about dehydration a year ago, so bring some water with them. Go to the park, sit down. They love to watch the kids playing on the playground and on the swings and on the slides. So like an hour and a half of that, as opposed to sitting in the house all day long, can make just a huge dramatic difference in the mental well-being of our clients.
Gregg, on your website, the words custom care plan are quite frequently mentioned. First, a couple of things, really. Are the custom care plans typically set up with parents of the adults or with the actual adult themselves? Part one. And if it is the children, have you been getting involved with them with Zoom in order to that kind of thing? To come up with this plan?
So that's a great question. So obviously, as it says, custom care plan, every client and every situation is unique. So when we first get a call, sometimes it's from the client themselves, sometimes it's from the adult, an adult child, it could be a grandchild, a niece, a nephew, a neighbor. We will probably spend anywhere from a half an hour to probably sometimes up to 2 hours on the phone, having a very in-depth conversation, really trying to get to what the issues are with that particular client, how it's affecting that client, how it's affecting the loved ones, the children, the neighbor, the grandkids, and we start to begin that care plan, in that phone call. From there, we then send out either our RN or our client care coordinator, sometimes both of them, to the house. They do an assessment of the client themselves, that assessment of the client's, house situation, living situation. Sometimes we need to make recommendations for things like, shower, grab bars and showers, or a shower chair, anything we can do to, help improve the safety in that situation. So every plan is definitely unique, and a lot of time and effort goes into making sure that we customize that plan to that particular client's needs.
So that certainly is a big topic. We do have to take a quick break. You've been listening to Project Independence and You here at Senior Talk Radio, WCWP.org, and we will be right back.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to WCWP.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. Those little button things on your phone screen. Just ask your grandkids.
And welcome back to Project Independence in You here at Senior Talk Radio, WCWP.org. I'm Rebecca Miller, and I'm your guest host today for Project Independence in You. We've been speaking with Gregg Balbera from Right at Home. He is the owner and also a certified senior advisor. Before break, Otto, we were talking to Gregg about custom care plans. So I know that you had some further questions related to that topic.
Yeah, well, like we said during the break, it's like building a house. You know, the custom care plan, I suspect, is in the same analogy. You know, do you want 1 bedroom, 4 bedrooms, 2 bathrooms, or whatever? If we could just get kind of a general overview, because most people will always think about, well, how do you pay for this stuff? And
Sure.
you know, reality is healthcare in general is relatively expensive, and it helps to have some financial guidance, if you will, or support. So maybe just give us an overview of how that might work with Right at Home.
Absolutely. So definitely part of when we are building that custom care plan, we're obviously discussing with all our clients certain, have different methods that they can use to pay for our services. Obviously, private funds are certainly usually first and foremost. Many people have long-term care insurance policies that they've been busy paying into for 20 or 30 years. And long-term care pays exactly for what we do, which is providing care in the home, or sometimes even care in assisted living facilities. So that's certainly 2 methods. Many of our clients are veterans. We have a really strong relationship with our VA here on Long Island. So I refer many of my clients and prospective clients to the VA because they're not aware of services that the VA can provide. So some of our clients can get anywhere from 8 to 16 hours a week of service at no cost to them that the VA will pick up. For them, there's another level of service at the VA called the Aid and Attendance Program, which is available not only to the vet, but also sometimes to their spouse. There are certain conditions that have to be met. So I have a contact over at the VA that I'm putting a lot of our aides and a lot of our clients in contact with. Additionally, a lot of our clients or prospective clients, oftentimes they've worked in, if they were teachers or they worked in a union, sometimes they have benefits they're not even aware of. That benefit might include a catastrophic care plan through their union. So someone who's had a hip replacement or a shoulder replacement, or now if they have Parkinson's or advanced dementia, they may be able to get benefits through those policies that they had as a union member. Sometimes the union provided long-term care insurance policies. So we're constantly trying to help all of our clients get different avenues of payment sources that are available to them. And then our services themselves obviously kind of range based on, are they taking like the lowest level of service versus if they're having, or versus maybe are they bed bound and have like the highest level of service. So that obviously impacts the conversation as well.
Is there any, would you be considered in addition like an out-of-network provider?
So the care that we provide is mostly considered non-medical. So traditional healthcare, medical insurance generally does not cover the services that we provide. I personally disagree with it, but I don't get to make those decisions.
Right.
On occasion, I have had some clients go to their, depending upon their, their health insurance plan, find that they were able to get some benefits through their health insurance. And wherever we can, we're happy to work with any agency or insurance company that we can.
So the majority of your referrals come in from the VA. Where else are you getting referrals from for the most part?
I wouldn't say the majority come from the VA. Obviously, we have a website, so a lot of people, will these days, most people are using Google or Safari or whatever, and they'll search. So we come up in a lot of searches. There are specific senior care referral networks, like caring.com is a big one. As an agency ourselves, we have something like 150 5-star reviews on caring.com. So a lot of people will see that, and that's 150 testimonials. So that's very important for a lot of people to see. We get a lot of word of mouth. Some of our some of our clients live in, over 50 condos. So a lot of times, one neighbor will see someone with a client that has one of our aides, and they see what a wonderful job is going on. So there's a lot of word of mouth, that way. So we also work closely with a lot of hospitals and rehabs, assisted living facilities. So we get a lot of referrals from there. So we have a wide variety of referral sources.
So if someone's listening to the show today, do you have a magic phone number they could call too, or is it all through your website? Is it best?
No, absolutely. Anyone can reach us. Our main office number is 516-719-5999. And our website is www.rightathomeli.com. LI short for Long Island.
Now you're located, sorry, but you're located at multiple locations on Long Island now, right?
Yes, we have an office in Plainview. We have an office in Smithtown. But obviously our care is not taking place in our office. Our care takes place in the client home, as I said, wherever that client resides.
Right. Now, I also noticed, I was on your website, and just to promote this, there's an aging in place guide that you have that was offered to people, which I did get, and I think it's excellent and has a lot of very good stuff. So, again, people can go on your website, and I thought the guide had a lot of good ideas. So we can put that up on the screen
Sure.
when it's on TV.
Thank you. And we also we put up about at least one blog a week on our website, ranging from a whole different variety of topics, like are you ready for home care, incontinence, Parkinson's, dementia, we must have over 100 blogs on the website, so it's a great resource for people who are starting to consider home care or have some questions about what's going on with their loved one and aren't sure where to start. So you can go there and get a lot of preliminary information.
I got one other one, I'm sorry. The area of technology. I noticed the word on your website, and I'm kind of a big proponent of seniors using technology, but I believe that a lot of people who are isolated at home can gain a lot from technology. Do you get involved with that at all?
Absolutely. So especially during COVID, because of the isolation and the potential for isolation and depression in our seniors over the past year with COVID, we have taught a lot of our aides and encouraged a lot of our aides with regard to how to use Zoom or how to use FaceTime. So our clients, maybe had those options on their iPhones or their Samsung phones, or they have iPads, or even on their computers. So one of the big things that we have spent a lot of time doing the past year is helping to connect our seniors with their loved ones. Again, many of their, because they haven't been able to see their children, their grandchildren, their nieces, the nephews, whoever it might be, the ability to connect via Zoom, via FaceTime, even if it's just a phone call. We've also so that use of technology has been tremendous for us over the past year. Many of the seniors themselves just they're technology challenged. Not all. Well, we have some that are just awesome with technology, but others are just very technology challenged. So our aides will sometimes use their phones or their iPads when they come to work, and they'll help using their own technology make those connections between the client and their loved ones.
Would that go also to things like Alexa or medical alert type devices?
Yep.
Guidance for that type of thing?
Absolutely. Absolutely. So a lot of our clients will have life alerts or similar products. We've helped quite a few of our clients get those types of products. Alexa and Echo and all those products that are in the home now are great resources. You think about the old days, the commercial, help me, I fall and I can't get up. So for that person who doesn't have a life alert, perhaps if they have an Alexa or they have an Echo, if you can say, hey, I've fallen, I can't get up, Alexa, Echo will recognize that and can call either 911 or can call an emergency contact that you can set up, in those products. So that's important.
I agree.
Yeah. I mean, so I think, so many of us that serve seniors for the last 5, at least 10 years have been trying to figure out ways to get technology into the homes of seniors. And I think that one of the good things, we always try to look at something positive from every scenario, but I think COVID really forced it for those that, would be open to it at all. We do with Project Independence, all of our programming, we continued since COVID. And it's, we're lucky enough to also have North Hempstead Television. So seniors that are not tech savvy at all or don't have a computer or a smartphone can see a lot of our programs on government channel. But certainly for those that were open to it, Zoom has been just an incredible resource for us internally, and also for the seniors. So that's kind of like a little, I know we talk about nuggets, right, Kristina? So that's like a nice little one nugget that kind of came out of COVID, was really those seniors that were going to be using technology started to use it.
Absolutely. And I would say, especially Zoom and FaceTime, the ability to see the other person, especially with regard to today's topic, which is, mental health in our seniors. There's a lot of things that, just maybe over a phone call that without the visual that you might not be able to pick up. So there are certain things that you can pick up, with the phone call. Has your mom or your dad, have they lost weight? You really can't tell that over a phone call, but in a Zoom call, you might be able to see that. So just things like that the technology has really enabled, and kind of pushed forward here, during COVID has been, very dramatic.
This show right here is a perfect example of that. If we were just on the phone, I could be sitting here maybe making a jigsaw puzzle while we're talking, but I can't do that because we're on stage here. And I think that's a good thing. I think the fact that you can have a visual contact with people makes communication so much different than just being on the phone. The phone is fine, it's good. But it's better when you can see, like you said, see who you're talking to.
Very true. We have to take a quick break, and when we come back, we'll continue speaking with Gregg from Right at Home. You've been listening to Project Independence and You here at WCWP.org, and we'll be right back.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence and You here at WCWP.org. And I'm Rebecca Miller, your guest host for today's show, along with our co-host, Otto and the wonderful radio show producer, Kristina Liu. We've been talking with Gregg Balbera, our guest today, who is the owner of Right at Home, and Gregg is a certified senior advisor. So we got a lot of information in the first half hour. And I know that we're gonna get a lot more right now. And one of the things that we're concerned about with our loved ones and also ourselves, is when is the aging process normal, when you're forgetting things or misplacing things or having other aches and pains, and versus when maybe there is something to look into. How do you gauge that? There's two things. How do you gauge it on yourself? If you're having concerns about yourself, and how do you also kind of gauge? How do you gauge as a loved one you have a parent, an older parent?
Sure. So discerning between normal changes of aging and mental health disorders versus not normal are never kind of easy to diagnose under normal circumstances. Obviously, during COVID, has become more challenging because, as we said, the lack of in-person visits. But certain behavior changes that I think people should look out for, which can certainly be a kind of a tipping point, would be things like, is your loved one sleeping much more or less than usual? Are they feeling unusually confused or on edge? Are they exhibiting low or no energy? Are they eating more or less than usual? Are they experiencing prolonged grief that doesn't subside? Do they no longer have the interest in certain hobbies or interests that they had, beforehand? Do they seem to exhibit a feeling of hopelessness or helplessness? Do you see differences in their smoking or their drinking or using drugs that they weren't using beforehand? And obviously, maybe the most significant, are they expressing any types of thoughts of suicide? So any of those types of, changes in behavior should certainly be the type of the thing that you should take notice of, and then maybe say, hey, maybe we need to schedule an appointment with our, with our regular doctor to get a checkup, see what's going on. That would definitely be kind of a starting point for us. And for us, those types of things, especially with our, with a lot of families being disconnected and not being able to see each other, one of the things that that our aides do is they'll report those types of changes in behavior, changes in condition. So our nurse will be very active in saying, okay, that definitely doesn't sound like Jane Doe. We need to reach out to the family. We need to make a doctor's appointment. We need to kind of step things up here and take things to the next level.
I think sometimes when you're also dealing with the geriatric community and they have some of the symptoms that are related to mental health, depression, that kind of thing, I think they immediately think, or the person thinks, or the family member thinks that it's dementia. I mean, you can get a lot of the symptoms, from depression too,
Absolutely.
So I think people are hesitant. They're just so afraid of, of an awful diagnosis to kind of, get to their healthcare provider. Is there a way that you kind of, I want to say, assist people, to get to their healthcare provider based on their symptoms, and kind of like with a little, it's probably not dementia. I don't know how you kind of, speak to people or get them to their providers.
Sure. So we obviously, in the course of our day, in the course of our business, we are having a lot of conversations. People start to, the loved ones start to sense or see some of these symptoms that you're talking about that can be related to dementia. So a lot of the things that we can kind of, somewhat self-diagnose in the beginning. First of all, a patient or a client who is on a lot of different medications, sometimes it can be as simple as certain medications don't necessarily play nicely in the sandbox together. So sometimes when we start to see some, if a client has just started taking some new medication and we get very different behavior, very different dramatic behavior soon after taking new medications, what we'll do is, again, our nurse will reach out to the pharmacist, reach out to the doctors and say, hey, Jane Doe just started taking, whatever drug it is, and all of a sudden we're seeing different behavior. So sometimes the pharmacist will say, hey, well, I didn't realize, because they're getting certain drugs from a different pharmacy and they're getting these drugs from our pharmacy. But when they put the whole picture, when they put the whole puzzle together, they realize that, drug A and drug B don't really work well together. And there might be an alternative to A or B that can eliminate certain of these symptoms. So that's a big part of it. Again, there are certain aspects of aging. Sometimes we lose a word, or we don't think of something. That doesn't mean we have dementia. That's just a normal part of aging. Our brain is not functioning like it was when we were 21 years old. We like to call that tip of the tongue, but back of the mouth, right? So it's like we don't necessarily, we struggle to find that word in that second, but 30 seconds later, we remember the word, or we remember the specific event that we really wanted to talk about. So that's normal. So a lot of times we have to allay a lot of fears in both our clients and in their loved ones that behavior is normal for someone who is 70, 80, or 90 years old. Now, sometimes the symptoms are more pronounced, and we get to a situation where dementia becomes an issue, or is becoming prevalent and present. And then we want to get the family the right resources. We want to make them aware of what dementia means. Everyone's dementia is different than everybody else's. Dementia there's many different forms of dementia, Alzheimer's being the biggest form of dementia, but there's vascular dementia, there's many different types of dementia. So not every person who has dementia is going to follow the same path. Not everybody gets short-term memory loss or loses the ability to, have, let's say, take care of their personal care and their bodily function. So everyone's path is different. So a lot of times we are spending a lot of our time educating both the client and the families with, what it means, what they can do, how we can kind of, stretch the process out so that it doesn't become a big issue right away. And that's a big part of what we do on a daily basis.
On the meds thing, I have a friend who had somebody who was on Ambien for a long time, and that was finally mentioned to the doctor. And facts are that caused that person to have memory problems. They were in a fog all the time, as an example of medication issues. But I think that another thing that's important is that the person who is going through all these things doesn't know that they're going through them. You don't, if you knew, you wouldn't be having a problem, I don't think. It's complicated.
Absolutely. And one of the big issues we find, with dementia and depression is, I think in this country, historically, there's been a stigma related to depression, right? While depression is kind of a disease of the brain, sometimes it's not necessarily evident. If someone has a broken arm or if they have Parkinson's, and so they're exhibiting symptoms of Parkinson's, those are visible to everybody else. Sometimes depression is not visible. And because of that stigma, a lot of times people are afraid to ask for help. So I think it's very important that, that the loved ones or the care providers, whoever that might be, let that person know, and letting the family know that actually the stronger thing is to say, I need help, and it's okay to ask for help. And that when you get the help, you're going to potentially feel better. In fact, sometimes feel much better. And if we can get past that stigma of the that it's, depression is a problem, we should kind of hush it and keep it in the closet. That's an important thing. And I think as a country, we've made a lot of progress in the last 5-10 years on that front, but we still have a long way to go.
Well, the older generations, which I'm part of, are probably more guilty of that than many others, because you grew up in the, tough it up, you can handle it.
Yeah, rub some dirt on it and get back out there.
Yeah, right, it'll go away. Yeah. Rub a few spots of dirt on your head and maybe the depression will go away. I don't think they even knew the word depression when I was a kid. I never heard it. Let's put it that way. He's in a bad mood, or, he's a real grump or whatever, but there was, I don't recall ever hearing that word when I was younger. But that doesn't mean it didn't exist. Obviously it did, just not in my world.
And a lot of times also we need to diagnose maybe what's causing the problem, right? I mean, some things are obvious. Someone's lost a loved one, a spouse, things of that nature. So that can obviously cause normal grief, but then there's a period of time where if that grief kind of just keeps going and going and going, and it isn't addressed, it can become abnormal. And so, helping loved ones, come to terms and letting them know, maybe finding somebody to talk to, a professional, a psychologist, psychiatrist, having someone to talk to who can help someone work through that, those issues is very important.
Yeah. Greg, one of the things you had brought up was, I'm going to say it's almost medication mismanagement, when you're going to different pharmacies and there's not one doctor who's kind of managing or overseeing, or, sometimes even family members don't know. You go to the doctor in one visit and the doctor says, we're just going to increase your this and lower your that. And then, that changes, your little weekly pill box completely. Do you guys provide any level of medication management?
We do. So our on-staff RN does provide med management, but we also find it's really important to work with the pharmacist and the pharmacy, and to also, as you said, really, if you're on multiple meds, you really want to be getting those meds from one pharmacy, because that pharmacist, they're the greatest resource we have in this, to be perfectly honest. And if someone is getting, meds from 2 or 3 or 4 different pharmacies, and the pharmacist doesn't know really what's going on, that's the potential right there for an absolute disaster. So
and then you have the mail-ins, because a lot of seniors have to mail away for their 90-day prescriptions and things like that. So yes, it is the pharmacist, but it's also just somewhat understanding that there are medicines that maybe you're not getting through the pharmacy too, and changes. So
yeah. And to talk to Otto's example from a few seconds ago, where Ambien is known to cause, let's say, fogginess or some memory loss. So what happens sometimes is, you have a patient who's on Ambien, let's say, as an example, and now the family starts saying, well, dad now has memory loss, so they take him to a doctor, and maybe they don't even mention that he's on Ambien. So the doctor diagnoses, well, he's got memory loss, so maybe he's starting some type of dementia. Now they just prescribe another medicine, which could have another unintended side effect. So it's like one medicine can beget another side effect and down the line. And it's like if you just remove that first medicine, all those problems can go away, immediately. So also, besides talking to your pharmacist, if you are bringing your loved one to multiple doctors, it's important to let the doctors know the other meds that the other professionals have prescribed.
Interesting. Okay.
I mean, you really should have a sheet that summarizes. I'm sorry, but
Exactly, Otto. When we come back, we'll just mention that it's a good idea. We have to take a short break, and then we'll be back with Gregg Balbera. You've been listening to WCWP.org, Project Independence.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence and You. I am Rebecca Miller, your guest host for today's show. We've been talking with Gregg Balbera from Right at Home. Before we went to break, Otto, I know you had a point. We were talking about medication management. So important to keep that cheat sheet. Every change in medication, everybody should just have a list and keep it on them or keep it handy. Just make sure it's as much up to date as you can. So when you do go to a doctor or a provider, or if an emergency happens, that you have that up to date information with you. So point well taken, Otto. One of the things we were talking about over break was, I want to say caregiver syndrome, but so many people, Gregg, too, we talk a lot about this with Project Independence there, the spouse of somebody who may have dementia, ALS, whatever the spouse is having, and they don't even identify themselves as a caregiver. They're like, I'm not a caregiver. It's my husband. It's my wife. It's my child. It's whatever it is. I'm doing what I'm doing. So, and after a while, certainly taking care of somebody with so many issues has an impact on that caregiver. And, so we were talking a little bit about what Right at Home does for those caregivers, and curious to your take on people who are caregivers but don't even identify themselves as caregivers. And you have to say, no, you're a caregiver. Sure,
that's part of the education process for sure. As you said, a lot of times spouses just think, for better or worse, this is I love this person for 50 years, I'm going to do it. But they have to realize that, self-care is as important as the care they're providing for their loved one, because if they don't take care of themselves, they may not be around for much longer to provide the care that their loved one needs. So it's very, very important that, family caregivers, get what we call respite, and that's a break. And, again, every situation is different. Person A may need, an hour a week break to just kind of do whatever, and some people need multiple hours a day. Every situation is different, every case is different, but it's super important because caregiving around the clock, as I said, is emotionally, physically, mentally challenging. And if and studies have shown that the stress of family caregiving can be so high that oftentimes the healthy caregiver ends up passing away before the sick person because of that stress. And then that creates a whole nother dynamic, because now that person's passed away, who's going to take care of the remaining sick person?
Right. So another kind of avenue that's totally related, and wanted to get your kind of input on that is mental health on versus physical health, and does it have an impact on physical health, and does one have an impact on the other?
There's no question that that flows both ways. Being physically sick will obviously affect your outlook and how you see things, and how and can certainly lead to depression. can lead to isolation. So it's important that that the person who is physically sick is getting the appropriate care, not just for the for the physical ailment, but for the possible mental outcomes of that. And then vice versa, someone who is let's say providing care and is becoming very stressed and becoming mentally sick can start to exhibit physical. Think of an ulcer. Someone who is stressed out, all of a sudden, they get an ulcer.
Right.
They're not getting the proper sleep because they're so stressed out. They're afraid that, their loved one may get up in the middle of the night and they're a safety fall risk. So they're not really getting their sleep because they're kind of sleeping with one eye open, and they're thinking to themselves, okay, is my husband, is my dad going to fall out of, get out of bed and, take 2 steps and hit the floor? So they're not getting the sleep. So they're going to have issues. So that's a perfect place where like Right at Home works, where, we work, with clients all the time. When the loved one needs that respite break, we can provide that, whether it's daytime, whether it's nighttime. Sometimes for us to be there 8 or 12 hours, for an overnight shift, so that that person can get their sleep, so that during the day they can take care, give the proper
Right.
loving care that they need to their loved one. It can make a huge difference. And then sometimes we need to provide the care during the day as opposed to the care during the night. So again, every situation is completely different, but definitely super important that family caregivers are getting the rest. And then also, especially with COVID, sometimes because the family can't be there, our aides and our companions can kind of act as those family members. They can coordinate activities. They're preparing the meals. Maybe they're taking the person to the doctor or to physical therapy, or if the physical therapy is coming in home now because they're not going out, kind of coordinating all those activities, giving all that information to the family members. So getting everybody on the same page, everyone's aware of what's going on, can play a big role in the health and recovery of the patient, as well as the family caregivers.
You talk health issues, and maybe 2 weeks ago we had somebody on about macular degeneration, and I never really, I knew it was not a good thing to have, but I never realized the real impact that has on a person's mental health.
Sure.
There's so many things that you can't do when you have that.
Yeah, starting with driving, right? Once your macular degeneration really kind of advances, and either your health professional, your eye doctor, or the family basically says, mom or dad, we have to take away the keys. Your eyesight has become so limited to macular degeneration. Taking away the keys is one of the hardest things that we see, on a daily basis, because that is pretty much, the first sign that the person's going to lose some independence. Having the keys, being able to go wherever you want, whenever you want, that feeling of independence, that leads to a healthy mental outlook. So the second you take that away, you're risking that mental outlook can be extremely negatively impacted. So again, having like an aide or a companion, someone who can drive you a couple of times a week to the supermarket, to the library, wherever it is that you need to go, so that you don't feel that you're stranded in the house and that you're isolated, very important. And
This might be a good segue into one of the bullets that you provided us in terms of what if someone resists seeking help? Like, we come across daily, like you said, people have to give up their keys and they're extremely resistant and in, some forms of denial. But what about the whole big picture when someone just resists seeking help?
Sure. And we get that, that's a common question that we get all the time when we're speaking to our clients and their family members. So one of the things I think one of the things that we always try and convey is that one is we're not here to take away your independence. We want to promote as much independence as possible. So the things that you're capable of doing, that you still enjoy doing, we want you to do that each and every day as much as possible. The things that you are now challenged a little bit with, whatever that might be, that's where we're here to help you. So the aide, the companion, if that's meal preparation, if you have macular degeneration and you need assistance with meal preparation, or as I said, driving someone to a doctor's appointment or to the supermarket, the pharmacy, those little things that we can kind of keep your life going, keep your independence going, so you can do the things that you like, so that your family isn't saying, okay, maybe now we need to consider other options for you as opposed to living at home when you really want to live at home. That's where we make a tremendous difference at Right at Home.
It goes back to that custom care plan, really. What are the needs of the situation?
Yep.
And I can
And
imagine,
the custom care plan changes. The custom
yeah,
care plan, we have clients that we've had for 7-8 years. So obviously the custom care plan that we developed in 2013 or 2014, that changes in 2016, 2018, 2020, 2021. So we're constantly evolving and changing the care plan to suit the ever-changing needs of the client.
We don't have a lot of time left, and because this topic is mental health, um, what if someone is talking suicide on any level? What as a caregiver or family member, what should we do?
I mean, that's something that absolutely has to be taken 100% serious. There's no question. I would definitely say the National Suicide Prevention Lifeline, which is always available at 800-273-8255. You can talk to a trained counselor day or night, 24 hours a day is a super resource that everyone should avail themselves with. Not just the person who maybe is having those thoughts, but a family member who thinks that their loved one is considering that. In that situation also, I think you want to really be aware of what's going on with your loved one in the house. I mean, has that person bought a gun? They never had a gun their whole life. Are you noticing that they're stockpiling pills that they never did before? Are they giving away possessions almost like they're getting ready to say goodbye? Those are kinds of warning signs that people need to be aware of. And if they are, you want to have either that a conversation with your loved one, or bring in a trained professional who can help deal with that situation, because it can definitely be averted. Suicide rates actually is highest. Older adults have the highest rates of suicide of any age group in the United States. I think sometimes people are surprised when they hear that, but it's factual.
Right. Well, I mean, certainly you've provided a lot of really good information, and I don't want it to just sound so horrible, because what the services that you provide are really helping the senior age in place, live longer, be safer. I really like what your organization is doing for people, and I like how you said how do you talk to someone who's resisting, and you're saying where we're trying to continue with the things that you love, just in a different manner. So I think it's good that you kind of present it in a positive way, and not hey, you listen, your eyes are going, you're this, you can't drive anymore. So it's kind of important to present things like in a positive manner, and find
So
that positivity.
a positive approach goes a long way each and every day.
That's so true.
these are not easy topics, of course. There's no, everybody's different. Everybody will. I have no idea how I would handle it. I think because I've been through enough of this that I'm going with what Gregg said. Sometimes in order to maintain some degree of independence, you have to give up some independence. And that's hard to, where's that balance? If one of the things is you're liable to go out and kill somebody in the car when you shouldn't be driving, that's something you really have to give up, in my opinion.
It's like, Otto, we did the show on mindfulness, and it's kind of like, you have to at some point just accept your limitations, and limitations aren't a bad thing. They protect you, they make us safer, like even a speed limit or something like that. They're there to really keep us safe. So understanding what they are as we get older. I mean, I'm a yoga teacher, but I'm not teaching like I used to. I'm staying within, I want to say my limits, but the things where I don't want to hurt myself. I want to understand, where my body's at, or the things that I can do now and teach now. So, and we are now coming to the end of this hour. Gregg, thank you so much for coming back on the show. I'm sure you'll be back again.
My pleasure. Thank you for having me.
Project Independence and Youth Senior Talk Radio at WCWP.org.